Here's quite a shocking statistic. Heart disease accounts for nearly a quarter of all female deaths in our region. And the chances of women dying younger from heart problems is significantly higher here than in the rest of England. Well, as part of our week of special reports on women's health, our health correspondent Sharon Barber reports on the heart problems faced by women, often underdiagnosed, undertreated and underrepresented in clinical trials, and the hope that new AI technology could help.
60-year-old Jane Fisher from Northumberland was just back from holiday when she felt unwell.
I had sort of central chest pain. I had a shortness of breath when I was exerting myself. I had this strange feeling going down both arms. I suspected it might be angina.
But something wasn't right and she decided to call for an ambulance.
I phoned 999, went through all the questions. I was advised to take some aspirin. They did an ECG, which was extremely abnormal.
Jane was rushed to hospital, where she was told she was having a heart attack.
Absolute shock. It totally come out of the blue.
Jane hadn't realised because the symptoms were not what she expected.
People talk about this like an elephant crushing the chest. For me, it was far more central. I didn't really put it down to the fact that I was having a heart attack. I had nothing to actually indicate that that was likely to be happening.
The reason is in part because clinical work on cardiovascular disease has focused on men.
In men, we see the classic symptoms of sudden crushing central chest pain, which can move up to the neck and down the left arm, sweating, feeling pretty poorly. But in women, we know now that there are subtle differences, so the pain doesn't just go to the jaw down the left arm. Women can be vomiting, feeling very poorly for a long time, feeling quite short of breath, and usually so with unusual levels of fatigue as well. And of course, that important difference of sometimes it's not central chest pain, but it can be indigestion and reflux symptoms that ladies are experiencing that can be signs of a heart attack.
And there's a new worry for doctors. They're seeing younger and younger women have heart attacks.
So this region is one of the highest incidence of cardiovascular disease, and we're seeing that more and more women are running into problems at younger ages. We live in a region where there's low socioeconomic status and traditionally been high risk factors related to diet, exercise.
How old are the women coming forward that you're treating now or seeing?
So we see patients in their 20s, 30s having major heart attacks.
But now there's hope that new technology might help.
I'm going to feel a little bit of pressure. And right now I'm just taking a look at your carotid artery and your internal jugular vein. So those are
Here, Dr. Thompson's using an ultrasound to look at my arteries, and the medics hope that an AI system they're trialling can work out whether they're narrowing.
And this is typically what we do to take a look at if there are any problems that may be happening now or may happen in the future.
It's one of a number of new AI systems that are being tested, in the hope that it will help detect cardiac disease early. This one's being trialled in hospitals across the north.
Typically, a doctor would, after having a scan, would have to read that patient's scan by making measurements. And that can take a long time. They're literally using a computer mouse to make those measurements. Now, with our tool, it happens in less than a second. So with our AI, it would enable women to be scanned before they have any signs of cardiovascular disease.
And it's AI tech like this that may have picked up that Jane was at risk of a heart attack and came close to losing her life.
There's always that fear that you may not survive. Feeling the wind, feeling the rain on my skin, on my face, it just makes me feel alive, and I really treasure that, because at one point I felt I would no longer sort of be alive, so yeah.
Sharon Barber, BBC Look North.
Well, listening to Sharon's film was Dr. Louise Buchanan, a consultant cardiologist at the Cumberland Infirmary in Carlisle, who obviously is here now. So, Dr. Buchanan, how do we keep our hearts healthy? The big question to start with.
That's really important, isn't it, for women who we know have got a higher degree of heart disease than is often perceived. And the most important thing is keeping a healthy lifestyle, so making sure that we know what our blood pressure is, know what our cholesterol levels are, eating a healthy, balanced diet, and doing plenty of activity, physical exercise, and that will keep your heart healthy and hopefully prevent developing heart disease in the future.
So what are the risk factors specifically that women really need to know or be aware of?
Yeah, I think with women, as they get older, they're more likely to develop problems such as high blood pressure and high cholesterol levels. So when you are called for your heart check, go in and do that in your health check with the GP. Women attend for cervical cancer screening, breast cancer screening. They really need to attend their checks for their heart as well to ensure that things are kept as they should be, because there are medications that can be given to keep the risk to your heart reduced.
And you're never too old to start on this path of really, you know, taking care of yourself and your heart.
Absolutely not. And even after a heart attack, making changes to your lifestyle really can make a difference. One of the big ones will be stopping smoking. If you stop smoking within a year, your risk is reduced to half of that when you were a smoker. So really, those changes are vitally important for your prevention in the future.
Because I think one of the things that surprised me is that, you know, our symptoms can be different to those of men. Didn't know that.
We certainly see women presenting with different symptoms. So you see the posters with crushing central chest pain that men have. Women may just have jaw pain, arm pain, a bit of breathlessness, a bit of pain in the back, and that isn't recognised by women and sometimes clinicians as well as to being a problem with the heart. So we really need to raise awareness for women and heart disease.
Yeah. So the Cumbria Heart Centre, that must have had a big impact on tackling this whole problem.
Absolutely. So earlier this year we opened a new £3.5 million heart centre with more up-to-date facilities in order to help us deal with people, men and women, presenting with heart disease in a timely way, and we've certainly seen the benefits of that within North Cumbria currently.
Yeah, I'm pleased to hear that. Dr. Louise Buchanan, thank you very much.
Thank you.
Thank you.